Hi, Psych 101. My name is Jamie, and my topic is narcissistic personality disorder. So, what is narcissistic personality disorder? Narcissistic personality disorder, or known as NPD, is a mental condition in which people have an unreasonably high sense of their own self importance. Symptoms include, again, having an unreasonably high sense of self importance, require constant and excessive admiration. They thrive on compliments and, again, constant admiration. Feels they deserve privileges and special treatment. Exaggerate achievements and talents. Believe they are superior to others. Take advantage of others to get what they want. Behave in an arrogant or act very conceited. And have an inability or unwillingness to recognize the needs and feelings of others, so they are not empathetic. So, what are the causes? The causes for NPD are unknown. However, there are links such as childhood trauma, genetics, personality, and temperament. So, this goes kind of hand in hand with nature and nurture. So, although you may be prone genetically to have NPD, if you are raised in a way that is healthy, most likely you won't have NPD. However, if you are genetically prone and you had some kind of childhood trauma, including physical abuse, sexual abuse, or mental abuse, then you are more likely than not to suffer from NPD. So, what are the complications of having NPD? Without treatment, you can have troubles maintaining positive relationships at work, at home. You might also be more vulnerable to abusing drugs and alcohol to cope with difficult emotions, such as, depression and anxiety, which could ultimately result in suicide. So, are there any treatments? So, there are no treatments or medicines specifically used to treat NPD. But if you have other symptoms of other symptoms such as depression, anxiety, or other personality disorders, medicines such as antidepressants or anti-anxiety medicines may be helpful. But the primary treatment is long-term counseling such as psychotherapy. So psychotherapy teaches the patient how to relate better with others so that the patient can be, have a more enjoyable and more rewarding relationship with those around them. They also help the patient to understand the causes of their emotions, what drives them to compete, what drives them to distrust others, and ultimately why they dislike themselves and others. So here are some misconceptions of NPD. Is that people who are narcissistic are conceited. They have high confidence, they believe they're better than others, when in actuality they're very insecure and they have very fragile egos. They do not take criticism well, and if they are criticized, they behave in an totally it totally upsets them and makes them lash out at others. So they will ultimately avoid any kind of situation in which they might fail or be criticized. Being narcissistic just means you have a personality flaw. However, having NPD is a serious mental health condition and should be treated as such. So I know that I hear narcissistic, very frequently on social media. You hear about it. People are accused of being it. And it just seems like it's such an easy word for people to accuse people of being. However, it's a serious condition and it should be treated as such. A narcissistic chooses to not care about anybody. However, they don't understand how to be empathetic, which is why psychotherapy is ideal for somebody who suffers with this, because it teaches them how to be empathetic and it teaches them how to understand people and those around them and what their needs may be. So here are other facts about NPD. NPD is more common in males. It wasn't recognized until 1980 um, in the Diagnostic and Statistical Manual of Mental Disorders. So another thing I saw that was a common number was 5% of people have NPD. However, people who have NPD may not realize that anything is wrong. So they don't necessarily seek treatment for having NPD symptoms. Most likely they're going in because they are depressed, they have anxiety, they're alcoholics, they they maybe they have another personality disorder, or they, are drug addicts. And then NPD is discovered. However, it's very rare that somebody who has NPD realizes they have it and go in specifically for that. So that number is very up in the air. It's not concrete. It's an estimate because it's possible that more people have it. They just haven't sought treatment for it. So there was a study I found. This was in Mayo Clinic. They did a 12-month study, and they studied individuals who actually were diagnosed with NPD, and 40% of them had some sort of substance abuse. 28% of them had some kind of a mood disorder, and 40% of them had anxiety disorders. So again, it's when you have NPD, you have many other issues that coincide with having NPD. Because again, people who have NPD are more likely to be depressed, have anxiety. They don't feel like they fit in. So of course they're going to be depressed, or they have anxiety, and maybe they know that something's wrong with them. They just don't recognize what it is. Or they just think it's not them, it's other people. So again, there's a lot we don't know about NPD, but this is what we do know. So I hope you guys enjoyed my presentation. I know I did. It was very interesting learning about this because again, narcissistic is so easily thrown out there when really it's such a serious condition, and it definitely should be treated that way because so many people suffer from it, and they just need help. So again, thank you for watching, and I hope you guys enjoyed. Thank you. Bye.